Hello, this is Michael Keeter with Julian O'Connor with Influential Dental, and we're very happy to have Dr. Sam Shamardi with us today. Dr. Shamardi, thank you for being here. And I'm going to give a little bit of background about you, and we'll jump right in. So, a lot of you probably do know Dr. Shamardi from the various aspects of his career, but I'll go down a few things. First and foremost, he's a board certified periodontist, he's faculty at Harvard. He also spoke at Catapult. He's an entrepreneur and author. And throughout our presentation or podcast, we're going to talk a little bit about what drives you, Dr. Shamardi, your background, and what it means to be an influential dentist in the dental space. So I want to thank you for being here. And if there's something we do miss, please feel free to share with our audience on what you're about. So again, thank you very much for being here. And Julianne, it was great to see you, and thank you for being here as well.
Yeah, awesome. I'm so excited to have you on the show today, Dr. Shamardi. And, you and I keep running into each other at, oh my, I don't even know how many places, but we've had some fun and interesting dinners together, and it's great to have you. So let's kick this off. Is there anything else that you could share about your background, just off the top, that maybe we didn't mention right, out of the gate here?
Well, yeah, you guys covered a lot of ground. I think you hit the main points. Honestly, maybe too many places at once, but definitely mixing up the time between clinical practice, academia, speaking, and just some passion projects between hearing loss, finance, and starting launching a coaching program for 2025. So a lot of things going on, but all positive and all geared towards trying to better the field and solve some really, important issues. And I think that's why we're here.
I have a question on that right off the top of the show here. So hearing loss, why hearing loss? Why did you get into that? And I say this from a personal standpoint. I have my own hearing loss. And so I had no idea until I was looking at your website today that this was an area that you were focusing on. Can you tell us a little bit about that?
Yeah, really overlooked even by dental professionals. It's kind of more accepted that you age over time and naturally you lose some of your hearing, but that's actually completely not the case. Completely preventable problem, and something that dental professionals, because of the environment we work in, we're literally in the bullseye. We're in the eye of the storm for being at risk. So, hearing loss you develop due to prolonged exposure to high levels of noise. So you look at dental professionals, our average career is 35 years plus, and every single thing in our environment, between the handpiece, the suctions, the ultrasonics, lab trimmer, you name it, there is not a single thing in our environment that we use day to day that does not actually directly cause hearing damage. So you put those two things together, it's pretty simple to understand why dental professionals, to some degree or other, all suffer from some degree of hearing loss. And it's a scary problem. It's something I looked into and started getting involved in now. It's scary to admit, but it's been about 12 or 13 years. Once I started looking at the literature, it was pretty scary. We think about what it does to our sense of hearing, which we only have five senses. So if you think about the fact that this is affecting one of them, that's kind of a big deal. But then when you start actually paying attention to what this does to your systemic health, in addition to your loss of your sense of sound, it gets even worse. It's actually the hearing exposure is directly linked with cardiovascular disease and death. It's directly linked with things like dementia and Alzheimer's. It's directly linked to things like low preterm birth weight, diabetes, learning and productivity issues. I mean, this problem is so big. And I've been speaking about it now for these 12 or 13 years. And it's really unfortunate how much has been overlooked within the dental society, within the dental community. And it's something that I think is so important that I'd worked in, helped develop a hearing product, basically a electronic earplug that clinicians could wear that would not affect their communication, which is the big reason why we don't want to have something in our ears. But you'd still be able to hear things 100% HD, not get any hearing damage. So if I had a high speed running by my ear 24/7, I'd be totally fine. So really made a big difference.
So this is a protection
Yes.
device?
Yes.
That's incredible, and it's on the market now. People can get it now.
Yeah, so I had it on the market for years up until about a year ago, more or less. We pretty much sold out of whatever we had still in stock. I'm actually in the process now of getting a new improved one to come out on the market. That should be pretty soon. And really, it's been more. I've done this. Been fortunate enough to speak about this topic literally around the country in Canada and Australia and New Zealand, tried to really spread word as much as possible because again it's such a big deal and something that unfortunately clinicians don't put two and two together. But once people start hearing about it, they all have that aha moment, and it's like, holy cow, what were we thinking?
Yeah, no, I agree with you. Being in the industry about 18 years and being in hundreds, if not thousands of offices, it is a very loud environment. And that's the last thing you think about, right? And now that you talk about the systemic relationships and how stressful it is to be a dentist in general, as you write on, we talk about, whether it's financial industry, is it communication skills and other things. And so I'm glad to hear that you're bringing it back, and we'd love to talk to you more offline about that and maybe how we can help, because I do think that's very important, especially how it all interacts with each other. So that's great. You're doing something that the majority of people aren't doing. Um, I'm going to back up a little bit in my question because I want to hear a little bit about your early days. I did a little research on you. You're born in Spain. You grew up in Southern California. Went to UCSD. And also, and my question is, how did you end up in Boston? You're still in Boston, and so on. So, how did a kid born in Spain, raised in Southern California, end up in the East Coast?
Yeah, it's a good question. I think growing up in Southern California, the East Coast is obviously a completely different world, country of its own. I think there was a little bit of a desire to get out of the bubble, so to speak. Once you're in Southern California, everything there, the weather, life seems pretty darn good. It's perfect weather year round, but I think there was more desire to kind of see what else was out there. Get out of the bubble, see kind of what was going on elsewhere, and once I had that opportunity for grad school, for dental school, came out here to Tufts, and it was an eye opener. Just seeing, the people, the obviously the weather, the lifestyle, not having a car, having to walk places, and just getting used to the personalities and the differences. It was a great kind of growing, experience, and a chance to just see that there's more out there. And now, of course, from a speaking standpoint, flying all over the place, it's a great opportunity to just see that, first of all, our country is amazing. It's huge. And every corner and every part and every state is so unique and so different. And I think it's important to kind of get out of your comfort zone and just see what else is out there, and just expose yourself. And that's kind of been the big thing. And, being here, life is different, but from a practice standpoint, it's great as a career, from a perio side, from the medical side. Obviously, a very academia. It's hard to beat. Boston science is hard to beat Boston. So there's a lot of pros in that standpoint. I do enjoy the seasons, although Cali people back home is home, and they're a lot friendlier in general. We'll just say that. Julianne knows a thing or two about this, so I don't have to tell her, but no, it's been a good experience, and who knows? Never say never about going home, but it's been great being out here for the time I've been.
Yeah, so when I was there, I don't know, did you go on the Harvard tour with us as a courtesy when I was out there and we all toured?
I don't know if I was there for that, but yeah, I'm there. I'm
'Cause-
there all the time.
Yeah, so you've been on the faculty, what, 14 plus years?
Yeah, I think this is it's been 14 now. Yeah,
Okay, gorgeous campus, by the way. I'm absolutely in love with everything out there. All of the architecture is beautiful. The buildings are beautiful, all of it. But yeah, I'm still a SoCal person
yeah,
all day long.
yeah.
So yeah, so tell us a little bit about being on the faculty at Harvard. I mean, that's a high honor, obviously. But what's that like, and how has that kind of fed into your career in dentistry?
Yeah, I mean, first you nail it on the head. It's a great privilege to be there, and really part of that's just about giving back. For me, having gone through all schooling and Tufts and then UPenn for Perio, there's specific faculty who really make a huge impact on you. who really, stayed late, helped you develop and grow, and you really realize and appreciate how big of a role they play in your life, in your career. So just kind of recognizing that, I thought it would be great if I had the opportunity to be in a position to do the same. So I've been fortunate enough to be there now, going on 14 years, like we said, and working with the residents. I'm in the post grad perio program, and just seeing the classes come and go, and to be able to provide whatever knowledge I can provide, some pearls. At the end of the day, it's about being exposed to as many different opinions and approaches as possible. So you don't go in there thinking that everyone's going to follow what you're doing, and that's actually not correct. It's always about going there and saying, this has been my experience, give this a go, let's give this a try, and then now do this similar type of case the next time, with another clinician, with another one of our faculty, and see their approach. Get exposed to as much as you possibly can. So once you go out there and you hit the real world, and now it's all on you, at least you've been exposed to things, and you have a little bit of a better understanding. And that part's been really important, and really, rewarding. Again, it's a time commitment, obviously, but it's something you do because you enjoy doing it. And it's just been great seeing the residents when you go to perio conferences over the years, and seeing those that graduated, and you see them doing really well, and just succeeding, and it's a good feeling all around.
I have a quick other question on that. I know Mike has some really great questions to ask you about too. But the last time Mike and I saw you speak, you were talking actually about burnout prevention. And yes. I know I was just on a podcast, and somebody called me from a school and said, hey, I heard you on the podcast, and we think this is an important topic. Come speak to the students, but the school won't fund it. And will you just come and speak to our clubs? So are you able to, I'd love to hear more about why you're talking about this. And then secondly, are you able to interject some of that as you're teaching to these residents right now?
Yeah, no, great questions, and really, really important topic. I think having been now in that 15 plus year clinical practice, I'm kind of in that sweet spot where you've been doing it long enough where you start noticing the changes in the trends, and some of the burnout, and some of that, we'll call it the midlife, mid-career, starting to creep in, where you're starting to think about other things and being affected by other things. A lot of my colleagues have had surgeries already for, hand, back issues, shoulder issues. There's a lot of career changes, cutbacks. Unfortunately, one of my closest friends and co-residents ended up, taking his own life a year ago. So there's been a lot of that stuff that really hits home hard. And when you're going through that process, and again, starting to take a deeper dive and see the stats, it's scary. So I think it's something like anything else where, years ago, it wouldn't be really spoken about much. It's a little bit more taboo, and people are starting to realize that everybody's going through the same thing. So really made it a big part to really emphasize that. I've actually been very pleasantly surprised in this past year at how many of the major conferences that I've been invited to speak at have actually requested for me to speak on that topic. So, that's really interesting, because usually it's come and do perio surgery and these other things, but they've actually themselves said, hey, we want you to speak on this. So I think that really emphasizes the fact that people are recognizing this and wanting to hear that. So that's been a really good opportunity, and to really be able to share the stats, the situation, talk about possible solutions. And it's something that everybody in the room can relate to. So I think it's a very, very important topic, and something that's affecting people a whole lot more as time goes on.
Yeah, and I agree with you. That is a great question and a great answer, Dr. Shamardi. And I think that needs to be something that is taught in conjunction with the clinical side. You have to be obviously clinically sound as a periodontist, as an oral surgeon or what have you. But again, unless you are right with your body physically, or right with your mind, whether that's relationships amongst your staff or team or with yourself, doesn't matter how great of a clinician you are, you're not to be at your fullest potential. So I think that should and continues to be. And I would ask those that are out there in the dental profession that are listening to this to, one, reach out if you are in that type of situation, to a colleague, or go to a course, or go to a talk that you speak at, or Julianne or others about it, because it is so much important, the mental health and the physical health as you as a person, right? So that's a shout out to all those out there that please seek help if you need it, but also to profess that, to go to those type of courses. A question I had that's adjacent to that is, one, why periodontics for you? You could have chose a different path in any type of dentistry. So I'm curious why periodontics. And then, you're also in academia and as an entrepreneur. That's awesome. Some people can only take one path or another. You decided to take multiple paths. So I know there's a lot of questions in there, but why periodontics? And then also, why academia that you continue to be, and then, as an entrepreneur.
Yeah, I think one aspect of it from the perio standpoint was the exposure to different type of procedures. I think for me, let's just say I tend to get bored easy, and some of the specialties, which are all great and all have their place, are a little bit monotonous. And for me, the appeal for perio was that not only is there a big variety of different procedures and surgeries that you're doing, but there's that really huge overlooked part of that periosystemic link that comes in. And it's something that really drives me up the wall, because we're still kind of having to come in and bring awareness to this. And this is something that, dentists always get that little knack between the medical community. And it's kind of like, oh, well, you guys are kind of not a big deal. And here we have this really authentic, we'll call it a golden ticket, where there is direct involvement with what's going on in your oral health, and specifically in your periodontium, that's directly related to diabetes and cardiovascular and Alzheimer's and cancer and all these major systemic health issues. It's like we should be preaching this from the top of every building, and we should have patients that are calling us right and left. And yet, between television, news, magazines, who talks about this? And the answer is nobody. And it really it drives me nuts. And that's another big part of wanting to be a speaker and wanting to be a periodontist, is that we are in a unique position where we can identify some of these systemic problems before they occur, or before they've gotten to a worse stage. And we literally have the possibility of saving lives, and we're not pushing it enough. And it just doesn't make any sense to me. There's a lot of things within dentistry, frankly, that make zero sense to me. And that's one of them. So ultimately, I can't start a bonfire and a strike outside the AAP and the ADA, but if I could, I definitely would. But on the flip side, it's just more, me wanting to get the word out and try and educate people as much as possible, and just kind of, do my part. So I think that's kind of the perio side, between the variety and the systemic part, where that comes in. And that entrepreneur part, kind of piggybacking off of what I was just saying, I think there's things about dentistry that are frustrating, where, in our education, we learn the clinical stuff, but that's it. And you talk to any dental professional, I don't care what specialty or general practitioner or what they do, if they were to give you a top 5 list of the challenges of their career, I can guarantee you that nowhere on that top 5 would the clinical dentistry come up. That's not the point. That's the easy part. It's always about, patient psychology and patient management. It's always about, the physical aspect, the musculoskeletal side. It's always about, the HR side. You name it, whatever challenges that people are having, it's about running the business and managing your overhead. And it's anything but what we've actually learned. And that's another thing that rubs me the wrong way. So for me, it's always been a motivation to just try and address some of those things. So that's where, hearing loss came from, and being like, why are we not being, educated and protected from this, when we're all losing our hearing from it? The book side of me writing that book on financial survival. We graduate and nobody has a clue of their student loans, and what the interest rate is, and how to pay things back, and what's a corporation, what's a write-off. And nobody has a clue of what insurances they need to have. We all get what we hear about, but nobody has a clue what their policy even includes. And then, I had it even happen with colleagues of mine. They get in an accident and they're temporarily disabled, and they think their policy is just going to cover them, and it doesn't cover anything because they don't have the right things in their policy. So all of these types of things that we could go on for, it's a matter of just more looking at the things that actually affect us day to day, whether it's the burnout, whether it's the lack of coaching, and whether it's a hearing loss, and just trying to bring solutions to those problems. And that's kind of really been what's always kind of driven me.
What would you say would be one of the boldest moves that a doctor maybe coming out of school could do right away to step into their power in all of these areas? Because, my understanding is there's not enough time to teach all of this in school, right? And so if there was one area that they should go focus on coming out of school as they start their career, what would you suggest for people to not end up where everyone else is ending up?
Yeah, it's a great question. I think one, that's part of why I'm launching a coaching program, and I say that from the standpoint of whether it's me or anybody else, just being in some kind of a program with peers who are actually there and wanting to help and provide this guidance. That's one big thing, because again, ultimately, you don't know what you don't know, and all it takes is a colleague to be able to make you aware of these things and just steer you in the right direction, and help you go after those solutions, and basically get yourself prepared. So that's the easiest way of doing it. And then ultimately CE is important, and just trying to get courses in basic, whether it's practice management or marketing. The hearing protection stuff, of course, is there, but that's pretty straightforward to do. I think it's just more trying to understand that what you're entering when you graduate is not just the clinical side. You're actually your own small business. So that comes down to just understanding whether you're an independent contractor or not. How do you manage your business? How do you manage your, the money side of things? How do you manage the people side of things, whether it's HR with your own staff that you may have to hire, and then also with patients. That's a whole skill on its own. How do we speak to our patients to make them gain trust in us? How do we speak to our patients to when we have to do thousands of dollars of treatment? They're going to want to move forward with it, and these are all skills that some people maybe are better at right off the bat, but a lot of people in some of these areas, just with time and experience, need to improve. But a lot of these things can be done a lot quicker off the bat, again, if you have that kind of mentorship or guidance or coaching along the way.
Well, I'd like to say, first and foremost, I love the enthusiasm and your passion for this. That's inspiring to me, because, again, we see so many dentists that get stuck in a rut for whatever reason. They don't have a way out, that there are avenues to find that. There are people like Julianne, and others that speak on this, that want to empower you to be a better person as well as a better communicator with everything. And like you said, clinical should be second nature. You still obviously got to be clinically sound, but there is help. And if you don't know, you don't know, but seek out ways to be better in these other areas. And so I love the passion. And I do think we're at the precipice of people in front of the ADA or others speaking their mind and saying enough's enough, right? We all should be clinical. We all are. But really, let's address some of these other issues you talked about. So I think having programs like this, having bigger stages at conferences with other organizations, is going to lead that way. So I applaud you on that, and hope other dentists and other dental professionals as well break out of just pure clinical dentistry. Let's talk about these other things to uplift and do better and be better.
Thanks.
Yeah, I have a question. So if you could give somebody a couple of tips, let's just go to the back to the burnout prevention piece, right? Because we all know it's a problem, right? And we know it's not getting taught, and people need to come out and, be prepared to make sure that they, give themselves self-care. But what would you say are a couple of tips that people can take away? Because it always seems so simple, but until you hear somebody say, "Hey, try this,"
Yeah.
we can't think of things to turn to sometimes, right?
Yeah, no, absolutely. And look, it's easier said than done. Certainly, depending on who your audience is, there's going to be people who are going to push back and they're going to say, look, I've got a couple kids at home. I've got a big practice to run. These things aren't that simple. And by no means, everybody's got their own unique situation. But there are some small things at the end of the day, from the physical side, for example, we all have breakdown, back pain, neck pain. And, there's some simple stretching exercises that make a huge impact. Going and getting a personal trainer for just a few sessions. It doesn't mean you got to be going full time and dedicating all this time and money, but even hiring somebody for a couple of sessions and just saying, look, I'm a dental professional. I've got lower back pain. I've got neck pain. What do I got to do? I tried that myself, learned a couple of specific weight exercises that I never really knew much about. And literally the change that it's made for my, lower back pain, which I pretty much just don't have anymore, came just from doing some exercises that aren't really that difficult to do. That's one very easy thing to do, just from the kind of pain management type of side. A little bit of stretching, some exercises make a big difference. So I think that helps a lot. Again, from the overall mental side, I think part of it is giving yourself a little bit of a break every now and then. And I think it's our own natural pushback to say, well, I don't have the time, and that's not possible. But I think when things come up, we can make the time. And I always, use this example of, if you get a call at the end of the day from a patient that, wants to come in as an emergency, and it's going to be a big case, magically you go from, well, I don't have time, to suddenly, yeah, sure, come on in. So the time is there if you want it, and it doesn't require a huge amount of time to just be able to take a moment for yourself. So whether that's just going for a walk, whether that's just trying to do some very simple breathing exercises that might take 5 minutes. I mean, these are all things that I'll be the first to say. Up until a couple of years ago, I would laugh off and say it's ridiculous. But I've noticed kind of the effects on myself. I definitely have a lot of the anxiety, agitation, compassion fatigue from the day-to-day stuff, and dealing with a lot of the just frustrations of patients and the career. And these are all small things that don't take that much time, don't take that much effort, but really actually make a big impact. So it's simple. It doesn't have to be anything grand. You don't have to spend a significant amount of money. I think really small things like that, and even just having a weekend where you just take it off and do nothing. You notice when you go on trips, even if you have to drive 3 hours from here to New York and come back, you only go for 24, 48 hours, but you come back and you feel like you've been off for a week. You have that natural kind of refreshed feeling, despite it not being very long. So again, it doesn't take a long time to notice a big difference. And I think a lot of us are so bogged down and rightfully just exhausted from our week. We're too tired to go and take that time. But I think when you kind of make yourself do it, at the end, you always feel better. It's kind of like exercising. You're tired, you're lazy, you're like, I don't want to go and work out. But once you actually do it afterwards, you always feel better. So it's
Yeah.
kind of that same concept.
It's interesting because I think they've come out with some studies recently that say that your happiness level peaks after 48 hours when you're on a vacation.
Yeah.
And so I thought, well, that's interesting. Just take more, 2-3 day vacations. And I think that's a really great piece of advice, actually.
Yeah, yeah. I mean, call it a mini sabbatical, call it a mini break, call it whatever you want. But even just a half day on Friday, ending a half day earlier, and just going and doing something you enjoy. You want to go play golf. You want to again go for a walk, go do whatever it is that you enjoy, but do something for yourself. It really makes a big impact.
What's one of the strangest things that you've seen happen when people get burned out in dentistry? Anything that you've seen or patterns that you see where people are not acknowledging that it's related to burnout, but they're having certain symptoms or ways that they're behaving, that kind of thing?
Absolutely, absolutely. And there's there's a chart that I looked at, which kind of blew my mind when I saw it, because I was looking in the mirror, looking at that, and realizing that everything on that chart checked off with me too. So things like reduced sleep, you just have a hard time falling asleep and you just don't sleep well. Things like irritability, which don't like admitting, but yeah, definitely more irritable. You get agitated more often or easier. Things like some muscle fatigue. I started noticing that as well, which seems a little bit weird. You're used to maybe getting sore from an exercise, but you tend to be sore for a longer period of time or to a greater extent, and you don't really know why. So if you start noticing you're not sleeping well, anxiety is a big one. You've got a difficult day ahead or a difficult case, and you catch yourself having either a higher heart rate or just feeling a little bit more anxious. Like I said, it doesn't have to be anything big or dramatic. The thing with this, similar to like a hearing loss, is that it starts very small, and these things all accumulate with time. So if you're noticing you're not sleeping quite as well, and maybe you're a little bit more anxious from time to time, or you're a little bit more irritable, you're less patient when you're doing your consults. These are very small things, but if you're noticing them, it's already telling you that things aren't kind of where they were before, and maybe there's more to it. You need to take a step back and take one of those extra days off.
I'm laughing only because I have all those symptoms, but it's all from sleep deprivation. I took a red eye this morning, as I think you know. But Mike, I'll turn it to you.
Yeah, no, I had a question about that because if you're not noticing them or you do notice them, what about those around you, right? Patients, the staff, whatever, right? So it's not only your own well being, your own health, but those around you. Because if you're not at your top of your game or you're having these issues, I'm sure that's feeding into others around you, right? Um,
Absolutely. Absolutely. Listen, it's a cycle. If that starts adding up, it affects your quality of work.
right.
It affects your performance. It affects the mood and the environment at the practice, because just like you said, your staff and assistants notice it. The patients start picking up on it, and it creates a cycle where the long term result of it is not good. It's working against you. So again, that burnout and that pressure is that feeling of like, well, I can't afford to take a mini break because I've got so much overhead and so many cases and so much I have to do. But on the flip side, when you're not doing it, this problem keeps getting worse. Your burnout keeps getting worse. Your performance gets worse. So you really have to force it. And like I said, the best example, if somebody wants to come in off hours or squeeze something in on your weekend, people don't hesitate. They'll take away what little free time they should have, and they'll say, "Okay, I'll come in." But they won't take that extra hour for themselves to take a little bit of a break.
Well, it's a pure mindset. And again, and the most important investment is yourself.
Yeah.
Because if you get sick or something happens, you're not going to be able to do those extra procedures. You're not going to be there for your staff, your family, and everything else. So people need to really realize in all industries, but especially dentistry, because it is so high pressure that you need to invest in yourself first, and whether that's education or self well-being and health, and have these type of conversations. I just had maybe tell us a little bit. I want to know more about non-dental, right? You talked about doing things. What do you like to do for fun? Where do you like to travel? What do you like to cook? Maybe some hobbies. I think our audience and I would like to know a little bit more as you kind of outside of dentistry.
Yeah, well, all the above. Definitely try and stay active as much as possible. I grew up playing sports, so I'm just kind of used to the active part, and really that was my stress release during school and during these past 15 years. It doesn't matter what kind of sport or active activity it was just trying to do that to help for the stress management and feel better. And now, like I said, some of that's also to help for just the back pain and all of that. So that's definitely something. Man, you said cooking. I mean, love food. Can't go without that. That's my
Guilty.
favorite.
Guilty.
So yeah, hey, look, Boston's got great food. And really, sadly enough, sometimes my friends would joke the only time they'd see me smiling in the day is when we'd be talking about like what's going on for dinner. So definitely a big foodie person. And yeah, travel obviously for the speaking all over the place. But if I do get a free chance, I go back home to Southern California quite a bit. And wherever I can go, that's new. It doesn't matter if it's somewhere local and it's a road trip, or if it's somewhere else in the States and flying to, or if I have the time and can go somewhere abroad. All of that I'm a go. So I try and do as much of that as possible.
I spoke in Kona yesterday, and I asked the group of doctors, I said, if you had a time machine and you could go anywhere and do anything, where would you go and why? And it was interesting because I had one doctor who said I'd go back to school and I would change my career path. And I thought that was really interesting. But my question for you would be is how would you live differently if you were never going to die?
That's a great question. I think, well, I would add a caveat to it: never going to die and remain young, because I think I think a lot of the pressure that we also put on ourselves. I mean, look, as a dental professional, it's tough nowadays. Some of the residents in the program, I mean, they're graduating with $750,000 of debt. So the reality for dental professionals is between your student debt and then buying in or buying a practice and then trying to have a family and have a home. I mean, we really feel that pressure of I don't want to be dramatic and say there's a gun to your head, but you really feel that week to week, month to month pressure. So, I think there's plenty of people listening on this who are saying, well, yeah, stretching and taking an extra day and doing all these things sound cute and great, but, I don't have that luxury. And we're trying to explain why, you actually need to make that for yourself. So you have that opportunity, but I understand and empathize with where that's coming from. I was almost, a half a million debt, graduating, and it's a huge burden, the amount of, stress. So I think, going back to your question, if you knew you had forever, then there would be a little bit more of a, I think, thought of, hey, you know what, I can take a little bit more time. I think a lot of us just feel this pressure of I've got to figure this out and I got to get out of debt and I have to be a success and I have to be able to provide and I have to do that as quick as possible because there is so much stress, there is so much of a burden that I think everyone's really trying their hardest to be a success so that they can live a better life. But I think it's tough because of those pressures and how hard we're pushing ourselves. Michael hit on it. A lot of us don't really get to realize that goal that we wanted at the end because we've burned ourselves out. We've affected our health and well-being so much. We've broken down physically so much that we work for that 20-year, 30-year, whatever period, and by the time we get to the point where we think, okay, now we should be enjoying things, either we're not in the health to do it, or we're not in the mindset to do it, and next thing you know, all those things didn't really end up happening. So I think in an ideal world, it's really telling people to try and maybe spread things out more, take a little step back, not put as much pressure on yourself from the beginning, and try and enjoy it a little bit more.
Yeah, I love that. It's interesting because just while you were talking about this, it made me think about how much it's beneficial to collaborate with people, right? And even you and I've talked about how can we collaborate, how can we do some things, and I think we're both out there speaking up about these topics, right? Burnout prevention, or how to mindset for your team, and how to build elite teams, all of these different things. Mike and I have come together and we're collaborating. So I think it's interesting to look at how can we all work together a little bit more and stop being alone. Even you and I going out and speaking, I think to myself, how can we go co-train more, and how can we bring more perspectives and not be alone and have a little more fun with this? Any thoughts on that?
Yeah, it's tricky because, like you said, a lot of these topics are now fortunately getting more attention, but a lot of times uh, these aren't motivations that people are coming to conferences for. So a lot of times we hit it on the head. It's usually, hey, I want to learn this new surgical technique. I want to see this newest composite that's coming out, and that's what's filling the room. But I think as time goes on, hopefully people start realizing that these are these topics that they should be looking into more. And I think the more that gains popularity, the easier it would be for people like us to have that type of exposure. That's why, podcasts like this make such a big difference. And these conferences starting to take note makes it such a big difference. So I think it's just a part of the education process, and getting the word out and spreading the awareness. And there are a handful of clinicians now, like myself, who are trying to do that. And with time, hopefully, that starts to take shape.
And I do think with like-minded voices and more of them, it's going to happen, whether it's directly to the dentist, within organizations, within manufacturers, even within their own companies. I mean, mental well-being, mental health, and the grind is real, not only as dental professionals, but those in the dental overall space. So I think we all, on this call and those out there, need to continue to fight that fight to be the best clinical dentist they can. But again, to always uplift and promote dentistry in whole, because it's a great profession. It helps a lot of people. We've seen people's lives change. It's not just helping them with an implant or a filling. It's truly changing lives. And so I think more of this is very, very important. Dr. Shamardi, do you have anything else that you'd like to share as we're kind of, wrapping up, whether it's about your website, about some of the projects you're doing, where you're speaking? As Julian said, maybe down the road we all collaborate. Is there anything that you would like to share with the audience in particular?
Yeah, I mean, collaboration wise, for sure. Looking forward to hopefully doing that, and again, helping to push these topics more as much as possible over time. I think the only other things I would say is hopefully, I can keep in touch with people listening in. So, just to help spread more of this information and content. So, obviously via social media, Instagram at Dr. Sam Shamardi, through my website, drsamshamardi.com, posting a lot of this. As mentioned, for 2025, I am going to be launching a coaching program in clinical surgical confidence. So going to be doing a lot in terms of the, perio and surgery side. Again, we talk about the difference between training and coaching, and really being able to provide, pearls and mentorship in a collaborative environment. So happy to be launching that, and really hope spread word and get people involved. And then, within that, while we're talking about, clinical confidence and surgery, we're definitely going to be bringing in some of the aspects. I want to be, speaking about some of this stuff in terms of, overall health and leadership and those types of things. So it's all kind of an overall package. So yeah, really, really hope people reach out, and hope to be connected with more people. And ultimately, the more we can talk about these things, the more people become aware, and ultimately we can just shine a bigger light on these topics.
I love that. I want to collaborate with you on your coaching. So yeah, for the listeners out there who don't know, I'm an influence coach, and so I help people with setting the goals and grounding it in quality of life, and how they can get there to their financial goals tied to their personal life, right? And so all of it has a place. So you have all of this clinical expertise, you have all of these other areas, and I'm sure you have an incredible team of people around you. I know you're working with some great sponsors, and it's really a lot of fun to have you on the show. What question would you say is not asked that you wish people would ask you on a podcast like this?
Wow, that actually is a great question of its own. I think you guys covered a lot. I think, God, if I was to think off the cuff here, what would be a great question? I think the biggest one would probably just be, what would you tell a dentist graduating to do different? I know you kind of touched on that yourself, but that's something that's usually not discussed. It's usually what can you do about this or that? And I think getting asked what would you have somebody do differently is a valuable one. That's probably the one I'd say most.
Yeah. And so anything that we didn't cover on that you would say that you would, add to this, what should they do differently?
Just to add on to what we said, I think the biggest thing at the end of the day is seek mentors. Seek people that are in your field that either directly, you've heard of, you've come across, you've seen at an event, whatever it might be. I think we would be pleasantly surprised at how many people, if we did ask, would be open to helping,
Yeah.
or just sharing their knowledge and wisdom. And ultimately, having an individual or a group or whatever it might be, again, the lessons you get from that are really, they're priceless.
Love that. Yeah, I'm a huge fan of having a coach, a mentor. In fact, everybody who's great in their field, no matter the field, they have a great coach. They have a great mentor. They have both in most cases. I think it's crazy when I come across industries where everyone doesn't have that. I have my own coach. Mike, you have your own coach.
Yep.
And
Yeah.
so, yeah, so it's incredibly important. Go ahead, Mike. You were going to say something?
No, I was going to say that it's important, whatever level you are. Like you said, it doesn't matter if you're right out of school, find a mentor or a coach, or if you're an executive of, Fortune 500 company. Everyone needs someone to talk to confide in, to always get better. I mean, look at pro athletes, right? They still are coached. They still do free throws. They do the basics, and I think in dentistry, kind of go back to basics, whether that's, like you said, taking time out for yourself. It's the little things that do go a long way. So, and Dr. Shamardi, you've said that, Julianne, you've said that, and our listeners say it, but they need to do it.
Right.
So is there a name for your coaching program, or how do they find that? Just by connecting with you, you'll be announcing it on Instagram and that type of thing? Or
Yeah. The program's called Mastering Clinical Confidence in Surgical Cases.
love
So
it.
I'll definitely, again, they can reach out to me again via, social media, the website. Going to be putting some stuff on the website about it soon. Collaborating right now with a lot of the great sponsors I'm fortunate enough to work with. So this is going to be a pretty unique, comprehensive program, and going to have great, sponsors involved. Going to have an in-person, weekend event. There's a lot that's involved with it, and ultimately, it really helped those clinicians that are doing a lot more surgery and wanting to get some clinical pearls. Obviously, from my standpoint as a specialist doing this for 15 years, I've had a lot of things I've seen, and avoid these pitfalls and tips in here. And so, really looking forward to doing that and bringing as much awareness to these additional topics as kind of like a supplement to that.
I have no doubt you're going to do an incredible job helping people to advance their careers much more rapidly than they would do it alone. So thank you so much for being on the show. I also want to just say thank you to American Dental Institute for having us co-host this podcast. And anyone who's interested in checking out some of their courses, they can go to americandentalinstitute.com to see those. One more time, Dr. Sam Shamardi, where can they find you?
Instagram at Dr. Sam Shamardi, website www.drsamshamardi.com.
Perfect. Thank you so much, you guys. Really appreciate it. Mike, thanks for
Yep.
being my co-host. Always a pleasure. And Dr. Sam, thank you.
Thanks so much, guys.